Tess, why is your foot up?
So it doesn't swell. Even though I'm like, how on earth would I know if it's swelling?
Well, you can see your toes from here.
Well.
And you can still wiggle them. That's a good sign.
Yes. No, I have been actively trying to wiggle them. And actually, to be honest, my foot felt pretty good on the whole.
Aside from that part last night where you're like, ah!
Yeah, I've had moments where it hurts, but they're pretty short-lived, and I don't know, like I researched all the things about recovery and stuff, and I mean, and they gave me 30 Percocet, and all of, Google and everybody seems to think that I should be in so much pain that I have to take Percocet. I'm nowhere near that. I don't know. I'm very baffled at either everybody else's response or my response.
Well, to be fair, most other people don't have more metal than bone in their feet.
Yeah. But it was also confusing when I had the major reconstruction. Like, I never, and I've always been baffled, was it just how long I was on the drugs that, I very rarely have felt pain in my foot.
Yeah, well, you also don't remember, the first 2 weeks.
Well, right,
so
I know.
I would say that one's probably the meds.
Yeah. But with this one, I went off meds pretty fast, except for ibuprofen.
Yeah, it was 2-3 days?
It was the second day I started
yeah.
on ibuprofen. And I don't know. I have brief, by brief, maybe 30-second bursts. And I've had maybe 5 of those over the last week where I'm like,
that's so nice.
That's a little uncomfortable. But I don't know. It's not a big deal.
That's really good.
Yeah. And I don't know. So I'm trying to follow the doctor's directions, which is why I have it up and stuff, but I don't know. It seems fine.
You're doing a good job. Ideally, we will keep it seeming fine.
Yes. Agreed.
So you're a week out.
Yep.
With 1 more week until your follow-up. Or 6 days until your follow-up. Your post-surgical
It's next
appointment.
Friday.
Yeah.
Yeah. It's today's Friday. It's next Friday.
Okay.
Yeah. And I don't know. They say 10 to 14 days is the recommendation for how long it takes to be healed. Which Sunday or the end of Sunday would be 10 days.
That doesn't mean you get to start walking on Sunday.
No, it's not. Not even. I'll wait till Friday to even start anything, but
we're not even allowed to take off the wrappings yet.
For sure. Yep. Have to be good.
You do have to be good. Well, and you're doing a very good job. They put a decent sized screw in that 5th metatarsal.
That is a big old screw.
Mm-hmm.
I definitely imagined a smaller screw when they said it's just 1 screw. It's a large screw.
Well, to be fair, your last one had a majority of tiny screws, so
That's true.
more than 40 from what I hear.
Yeah,
Though I have not gotten around to counting them on the x-rays.
40 seems high for sure.
It does seem high.
Based on the x-rays. But, I don't know. It's a lot of crap in there. Poor foot. Really, it sucks. I just was so determined to make that foot stronger and get to running and yada yada yada. And then I went and did the opposite of that.
Yeah, that was a bad plan.
So
You
annoying.
shouldn't have done that.
So annoying. Oh well.
It'll heal, and you'll do great, and you'll go back to running. That's the plan.
That's the plan.
Don't disagree.
No, I'm not. people at your job take care of people like me, sort of.
No, not people like you.
Not people like me.
No, you have a foot problem. They have brain problems.
It's a large difference.
It is a large difference. Yeah, so there's a difference in people when they have brain injuries. And we talked a lot about in the last one, like the memes or tapes that get played in our heads that make us who we are. And when your brain gets hurt, especially in a traumatic way, the interesting thing that happens there is that all those tapes and memes essentially get scrambled. So we do brain injuries, we do traumatic brain injuries, we do strokes, we do a variety of things. So when you have a stroke, which is what most people end up having, you can have two kinds of strokes. So generally speaking, you have either a hemorrhagic stroke or a TIA. And that's very, like an ischemic stroke. So hemorrhagic
There's one more. What's the third one? I can't think of it.
It's thrombotic, but it also goes with ischemic. Is that the one you're thinking of? So essentially the two types.
Oh yeah, that's the one.
Yeah, essentially the two types are either you're bleeding a lot where you shouldn't be, or the blood's not going where it should be.
Yeah.
So either way, your brain's getting hurt. And when a lot of people think of stroke, they think of a hemorrhagic stroke, which often comes from an aneurysm or something like that. Essentially, either you hit your head so hard that it starts bleeding where it shouldn't, or you get hypertension, usually, and then an aneurysm or a weak... Sorry?
High blood pressure.
Exactly. A weak part of a blood vessel explodes and floods part of your brain with blood. And that's very problematic, of course. A lot of things are, and and our goal with that one is to decrease your blood pressure, fix what we can, let it heal, do what we can with that. And then either TIA, thrombotic, the ischemic variety is where you have gotten a blockage somewhere that has cut off blood to a part of your brain. And our biggest goal there is to either flush it out or pull it out and get perfusion back to that part of the brain. And a lot of times the body will do that by itself, which is why when you come with an ischemic stroke, very often, lots of people call them mini strokes because the body can like pop it out as if you had like, as if your vessels were a hose and you had a small blockage of cut grass in that hose because you didn't clean up very well after you mowed the lawn. And it cuts things off for a little while and it builds up pressure, then it goes boop, and it pops that out. And you have to try to re-water the part of the lawn that got missed while you were doing that. So for that, we don't mind if your blood pressure is, so a normal blood pressure is 120/80. It's not technically normal. Actually, 120/80 is the highest it should be in general speech. So when they're teaching you in medical / nurse practitioner school, 120/80 is the cutoff. Anything above that, and you're bordering on hypertension and you need to start changing things up. So 120/80, 120 being the systolic number, or what is going out of the heart is the pressure on your veins and arteries. And then the diastolic is the bottom number, or the 80 in this case, and it's that return pressure as your body pumps it back in. In an ischemic stroke, a TIA, transient ischemic attack is what we call that. We are okay for at least the first 24 hours with being 220/110.
TIA is like it blocks and then unblocks.
Mm-hmm.
And then it blocks and unblocks. That's how they explain it to me in T school.
Exactly. Yeah. So a lot of people call that a mini stroke. So you have all the symptoms of a stroke or like a hemorrhage in your brain essentially, but it can go away.
Yeah.
And the problem with that one is that if it happens once, there's a reason it happened, and we need to figure out what that reason is. and we need to fix it.
Because something's still there. It's just like, it's like a flap kind of a deal.
Sometimes.
Sort of, yeah, potentially. But
Sometimes.
whereas you could get blocked again and have a full stroke.
Exactly. And that can be for a variety of reasons. Some of those are cholesterol, which is why we like cholesterol to be low, because it clogs those arteries and it can make a thrombus, and it can cause a plaque that will actually block that off and can break off and go back into circulation and like fix itself essentially. Some of that is from blood clots, especially like for people who are very sedentary. If you're not moving around a lot, you're a lot more likely to clot. And then people with diabetes are a lot less likely to move around a lot, and they're a lot more likely to clot. Plus, they've got that cholesterol very frequently, and that's type 2 diabetes that we're talking about, obviously.
And people post-surgery.
And people post-surgery because you're not moving around like you should be.
And that's why I'm taking baby aspirin.
That's why you're taking baby aspirin.
And I'm very adamant about it.
So the great thing about taking those things is that we give them
Your
to
dog wants to come in.
She can't. I'm still mad at her. You can take baby aspirin for a lot of those problems, and it will help like loosen things up, make sure that everything's flowing as it should be, and it can get through those narrow areas a lot more easily. And that's great. A lot of people, once they have more problems, are on something called Eliquis or Xarelto, and those are oral anticoagulants you can take that stay in your system for at least 5 days once you've reached therapeutic level. And those are great as well for making sure that everything's moving as it should be. But obviously, if we're going to do surgery, we don't want your blood flowing quite like that. So if you have had something like that and you've been on those medications and you come back into the hospital and we need to do surgery on you, we need to let those come out for at least 5 days, in which case we give you something called heparin or Lovenox, which is a low molecular weight heparin, which only stays in your system for a limited amount of time, much more limited than those oral anticoagulants that you're going to take. And that's why we stab you in the stomach a lot when you're in the hospital. So it's every 12 to every 24 hours, depending on your risk factors and what we need to do to make sure that you don't get clot while you're in the hospital itself, waiting for surgery or post-surgery, that sort of thing. So while you're in the hospital, we like to stab you in the stomach unless you're super stable, just to make sure that you're not going to clot up waiting for surgery or waiting for discharge.
I've never been stabbed in the stomach.
You have not, because you have very low risk factors. She's fine. Some people cannot have those things, in which case we do something called sequential compression. And we use something called a sequential compression device. So that's what we used for you when you were in surgery. It's got little things that wrap around your leg, and then it works like a blood pressure cuff, and it inflates this one, and then it inflates this one. It inflates this one, and then it inflates this one. And that keeps your blood moving as if you were walking, essentially. It's a lot more gentle than a blood pressure cuff, and it keeps things moving so that they don't get stagnant and potentially cause clots when you're post-surgical.
They knocked me out, then they put it on, then they took it off, then I woke up. So I never saw this thing.
I took them off you, actually.
You did?
Yeah.
Oh my god.
You still had them on when you were in recovery.
I was awake?
You were technically awake, but that doesn't mean you remember.
I'm just kidding.
Yeah. So anyways, all those aside, either type of stroke, mini stroke, TIA, what have you, it causes what we call a penumbra in the brain. Penumbra is Latin for shadow. So when you look at the brain on imaging, you're supposed to see gray, and you can think of that as your gray matter, essentially. So you see the outline of your brain, and it's all gray, and as we go through, it's all gray. When you see this penumbra, this shadow, is this darker spot, and that's the spot of your brain that was not receiving blood while whatever happened. This shadow can shrink as you recover. It doesn't always shrink all the way, but the goal of stroke recovery is to get as much of that shadow to shrink as we possibly can. Now, what happens while that shadow is shrinking is that your brain is trying to remake connections inside itself. And as it remakes those connections, sometimes it can cause trouble because it's just trying to make connections wherever it can. And sometimes those connections don't quite make sense to the rest of us. So it can scramble a little bit of your memory, it can scramble a little bit of your speech. If it affects either Broca's or Wernicke's area, you're going to have trouble with aphasia. So we have 2 types of aphasia, 3 types really. So you have receptive aphasia, where Wernicke's area is affected by your stroke, and it's really hard to understand what people are saying to you. So if you told me, hey, we're gonna have bagels for breakfast, if Wernicke's area is affected and if I have receptive aphasia, what I'm going to hear is entirely different. So I would hear, the telescope is on a dragon. And then I look at you like, you're fucking insane. What the fuck is wrong with you? And then Broca's area is the one where I produce speech. So you say, we're having bagels for breakfast. And what I want to say is, that sounds great. And instead of, that sounds great, what I say is, don't you hate dragons? And obviously that's a very crude example, but those are essentially what happens with Wernicke's and Broca's areas. And then a global aphasia is when neither what you're saying to me or what I'm saying to you makes sense to either of us.
We can't figure out humans to start with, and then they get their brains messed up, and we really can't figure out humans.
Exactly. Yeah. So the thing about humans is that you can, like we talked about in the last episode, is stranger danger. So you can approach people either in a stranger danger way or in a charitable reading way. Stranger danger assumes everyone is dangerous. Everyone is a potential serial killer. I need to do everything I can to protect myself from everyone, always. And then the charitable reading way goes, I'm a human. These people are humans. Let's try to approach each other as humans. And so if you are a caregiver, a nurse, a doctor, a CNA, coming into the room of someone whose brain has been scrambled, essentially, and you're approaching them in a way of stranger danger, this person is dangerous, I need to do everything I can to protect myself, you're going to be terrified of everything you're doing with them, because you are doing a lot of incredibly invasive things. We are stripping people naked to clean them off and stabbing them with things, essentially, to do IVs, to give them Lovenox. We are feeding them stuff they don't want to eat, like pills that taste so bitter in applesauce, and we have to crush them because your epiglottis doesn't work anymore because you had a stroke. And if you approach people in that way, in the stranger danger way, to do all of these things, you're scared of them, and they're scared of you. And it's an incredibly charged situation where everybody is just waiting for the next horrible thing that's going to happen to everyone, because we've all been traumatized. The person with a stroke has been traumatized, the person with brain injury has been traumatized, and the nurse has been traumatized, because a lot of these people can become incredibly, incredibly violent.
Right. Yeah, you're back to the somebody's gonna kick you, hit you, bite you.
Right, because
whatever it is.
I hate to say it, but more often than not, that is the more likely outcome.
Yeah.
The more likely outcome when somebody is used to stranger danger approaches to life and has something happen to their brain is that they will approach coming out of that in a stranger danger way. Everyone who is coming into their room is trying to hurt them in their view, and they need to do everything they can to protect themselves. So they're going to kick, they're going to bite, they're going to hit, they're going to throw full urinals at you, they're going to do everything they can to make sure that they're protecting themselves. And that's understandable.
It's like my alcohol theory.
What's your alcohol theory?
Where there's the different people have different reactions to drinking alcohol, where some people get mean and some people get happy, or there's a whole range of things that are kind of stereotypical alcohol reactions.
Yeah.
But my theory is that really alcohol just takes you back to a more honest state of yourself. And so if you're more naturally fearful and scared of other people, I think, your tendency is probably going to be more mean and react in that strong, violent way.
Yeah.
As opposed to if, your baseline is more charitable and kind, right? You're going to, maybe more of a happy drunk, where you're not living when your defenses are stripped away. You're not just terrified of everybody, right? Because when people are scared, that's when they start being mean, right?
So that's interesting because my father also had an alcohol theory, but his was very religion informed. So my father's alcohol theory was that, and I these days assume that this was because he grew up and or interacted with incredibly repressed people. But his theory was that whoever you are as a human when you're sober, you'll be the opposite of that when you're drunk.
Well, it's totally opposite of my theory.
No, not totally opposite of your theory, because I'm taking into account repression. So a person who acts super happy all the time, constantly, at church, and their general life and at work. This person who is always super outgoing, really wants to meet everybody, etc. When they get drunk, they will more likely tend to be a sad person and super withdrawn. When you take the repression into account, that person who's super outgoing, when they're not drunk, in my dad's theory, that's a sad person trying to find connection.
Yeah.
So that's where they were and how they approached life to fit in, essentially. And then a person who
right, they just get to be themselves without being repressed.
Exactly.
Yeah.
And then a super withdrawn person, in a lot of ways, in the way that I was raised or the way my dad was raised as well, that person has learned to be withdrawn because who they were was not socially acceptable to who they were with. So they'll get happier and more outgoing the more they lose those inhibitions with alcohol.
Yeah.
So it actually makes sense, because where you're coming from is it'll make you more of you because you're losing inhibitions.
Right.
And where my dad was coming from was also it will make you more of you because you're losing inhibitions. But also everybody we knew was so repressed.
So repressed. You
so
just can't be
repressed that
yourself.
you had to do the opposite of yourself to fit in with wherever you were.
You just have to mask all the time to be this perfect person.
Yeah. Well,
fit in whatever ideal was.
The cool thing is about brain injury is that it strips away a lot of that inhibition. In a lot of ways, how being drunk would do it. It seems to me. And other people could view this differently because we're all seeing the same people and we're all seeing them from different points of view, essentially. But when I see a person who's come into my unit, my nursing unit, what I see is a person who is scared and having the worst day of their life and has lost the ability to mask as they would in their normal life. And I feel like that changes the perspective, because we used to be fight or flight people, you and I, where everyone was out to get you. You had to prove you were better than them. You had to prove that you were more, you had a better distance and perspective on life than everyone around you. You had to prove that constantly. And that led to a very anxious fight or flight response to everyone, as opposed to when we flipped to the charitable reading approach, where you view everyone as a human, and then you can see this is a human and they're trying to cope, but their brain is making crazy connections that it never would have. They are terrified because they don't know any of these people and they're in an entirely unfamiliar place. And it's interesting seeing how people come out of that, because some of them come out of that really well as their brain starts healing itself, and some come out very poorly. A lot of that has to do with how bad their brain injury was in the first place, but a lot of that also has to do with how they were trained or how they decide they are going to recover. And so we have some really great patients and some really poor patients as far as how they deal with you, which is very interesting. And then as they make those connections more and more, you can see their personality come out more and more. And often it's an entirely different personality than it was before their stroke, just depending on how things rewire themselves. It's interesting because the personality theory that we all sort of depend on in general is nature versus nurture, what's born in you versus what's trained into you. And when you have brain damage of any sort, you can lose both of those things.
Yeah. That's crazy.
It is.
Well, and like my experience with my job, like we have like this weird assumption of some kind of normal. I think, just like you go throughout your day and you have a baseline of what you think of what normal should be, and everybody's is probably a little bit different, but you have that, and then, but then like it does not take into account the real human realities of just like you could have a subtle, small chemical imbalance in your brain. That nobody sees. You don't know unless you really specifically search for it, right? But it's there, like there could be some imbalance in your brain that causes you to perceive things a little bit differently, and so you act a little bit differently.
Yeah.
And that person's normal, right? They don't. That's just how their brain is working at that time, right? And on average, we don't. We because we just kind of take the lazy way of assuming there's some kind of average baseline of how humans are supposed to act, and it's really hard to fold in the things that are outliers.
So when you speak about that psychiatrically, which is my specialty, essentially. Thank you very much. Everyone has a lot of things wrong with them. It's not always a problem. We only define things as a problem when they cause you significant emotional, personal, or social distress.
Yeah.
Up until the point where they are causing you significant distress to where you cannot function, you cannot maintain relationships, or you cannot maintain a job, everything is normal. Which means nobody is normal. There's no baseline. The only baseline that we have as human species is coping with everything that's happening around us. And that baseline of coping has to get higher and higher the more shit you deal with. So a lot of what's happening nowadays being the weird political climate in the United States in which you and I live right now, it's starting to approach that baseline level for a lot of people where they've been coping and everything's been fine technically, everything's been normal technically. It's just getting slightly and slightly and slightly and slightly more ridiculous. And they're coping with this, and then that's bad, and then they're coping with this, and then it's worse, and then they're coping with it. And it just gradually brings up that baseline emotional resilience and emotional capacity until you look back at the memories that your social media brings up or your phone brings up, or you go back to your parents' house and you look at a photo album from when you were a child and you realize, fuck, I'm coping with a lot more than I should need to be coping with right now. And that's actually a problem, which is why you're going to see this emotional and political activism and outrage heighten after holidays, when people have been seeing those memories, when they have been going back and talking with people they don't necessarily get along with. You don't realize the rift that has been created between normal and where you are until it's drawn into sharp relief because you see it with somebody that you've talked to that you haven't talked to in a while, or a picture that you see of yourself and you realize, oh my God. And what you're feeling when you see that is what a stroke patient or a brain injury patient feels every time they wake up, essentially. It's like this disconnect from where you are and where you think normal should be. And it's terrifying. It makes people shoot each other, as we have seen this week. It's scary. It's a really terrible place to be. And if you take that, and then every caregiver that you have that comes into your room is approaching you as if you're the dangerous person, that's a recipe for disaster. Which is why we have to start bringing that approach back to where you were talking about with talking to children who are experiencing emotional distress in a variety of ways. You have to approach people as if they're actually people and they have a reason for thinking the way that they're thinking, and they're probably scared. And when you do that, you can start talking to humans as a human, which is not really well looked upon in what we have as a culture right now, which is sad.
Yeah. Well, and what I found, to bring some more attention into it, is that
Attention.
like when we start using words like love and seeing people as human, we tend to go very, it's very soft language. But at the same time, and that's important. Like, it is soft language, and there needs to be understanding and kindness as our base. And then at the same time, I found, especially working with kids, they desperately want boundaries. Right? They need that. They need to know how far is too far.
Yeah.
Right? Where is the line of, I'm ruining my relationship with my teacher doing this.
Yeah.
Right? Because and I try really hard to do that at my job. A lot of times.
Relationship with your teachers, or make boundaries.
Make boundaries.
Oh, okay.
Well, like at my job, a lot of times there'll just be a kid screaming at one of my staff members in the hallway, and I've made a habit of, I'll just go out and be like, you can't talk to my friend that way. That's not okay with me.
Yeah.
Right? And I'm just setting a boundary for that student of that is socially unacceptable behavior.
Yeah, but you're not just setting a boundary, you're personalizing it.
Right.
You're saying, hey, I'm a human here.
Yeah.
And you're hurting me.
Yeah. And my friends specifically.
And you're making that boundary based not on this is what the rules are. You're making that boundary based on seeing a person and responding to them as a person. Yeah. Which is also super helpful for brain injury patients. Because, super specific example. It's kind of an embarrassing example. Not for me, but it's going to make this episode have to have an E for explicit rating. So,
we're past that already.
We're way past that. So, there's a person I've been taking care of for quite a while now. They've been with us for a minute. And by a minute, I mean several months. They've lived on my floor in the hospital. And they have had a modified diet. They have not been able to eat just the plain old food that you would bring them because their swallow has been impacted by the injury they had to their brain, and they have not been able to swallow appropriately. This week, fortunately for them.
Which means they could swallow it into their lungs, right?
Exactly. They could aspirate it if they have the wrong consistency of food and or liquid. So they went all the way from not eating anything to eating purees and very thick liquids. So it makes a better bolus and it passes by your epiglottis a little bit better, and it can go where it's supposed to instead of going into your lungs. And then gradually, as that function comes back in that epiglottis, we can switch your food up. This week, after several months, they were able to graduate from pureed foods and moderately thick liquids to regular foods and thin liquids, which is great, very exciting. I was precepting someone, so I was teaching a new nurse how to nurse on our floor specifically, and that nurse went into the patient's room after hearing from speech and said, "Are you excited to have a new diet?" Because that's what we call it. This patient said, "Yes, I can eat anything now," which is great, very good understanding of what the diet orders were. And then this person continued, "I can eat pussy now." So, very happy. They understand the diet order, which is new. Understanding and diet order, both new here. This person has neither understood nor had diet orders like this before. The conglomeration of those two things in their mind meant they can eat pussy now. Which is not wrong. I mean, as far as secretions and bodily fluids go, they can technically eat pussy now. As far as boundaries go, that is not an appropriate thing to say to the person who is giving you care in a hospital in a medical setting. So, my preceptee beautifully said, "That is not an appropriate thing to say to me, but I'm happy for you," and left the room. You can be happy for someone and encourage them in their newfound liberty of eating whatever they want, including pussy, and have that not affect you. You can see, "I'm happy for you, that is not appropriate," and leave the room. So it's not mutually exclusive.
It's not.
You can have boundaries.
Yep.
And a healthy respect and appreciation for people's newfound freedoms. In a way, just for the record, that person is not eating anyone's pussy anytime soon. If for no other reason than they're on a bed alarm and the weight restrictions do not apply.
Well, and bottom line, the best way to teach people boundaries is to have your own safe boundaries. And it took me a while to figure that out, what that looked like
For sure.
at work. And just being able to say things like, "Oh, that really hurt my feelings." Right? And sometimes I'll say it even if like it didn't hurt my feelings that much, and I just know it should hurt my feelings.
Yeah.
You know, when kids are swearing at you, or you know, or just they're intentionally being mean, and so when I'm teaching, it's like I'm trying to teach. Like, I'm fine. I'm not. There's a reason I have my job. I'm not super. What's the phrase? Butthurt, or I don't know if I got that right, but
sensitive.
Yeah,
I think
not.
sensitive.
I'm not feeling super sensitive about
is
it.
the non E rating version of saying that.
But I'm trying to teach these kids, what the boundary is, right? And if you say that on an average day to somebody at the grocery store, they are going to have their feelings hurt, right? You start just swearing at somebody at King Supers, it's not going to end well, right? And so I'm like, oh, that hurt my feelings, right? And so I'm setting that boundary of you can't just swear at me without something happening to me. Right.
Right.
It still hurts.
You still have feelings, even if you're a teacher.
Right. I'm still
You still have feelings, even if you're a nurse. You still have feelings, even if you're a patient.
And I can use my own understanding of what's happening to me in the real life to try and teach these kids. You can't just do that to people without there being a consequence, without there being an effect. Because we try and teach people, teach these kids that to understand when harm is done, and that when harm is done, they need to repair the harm.
Right.
And if they don't know that harm is being done, when harm is being done, they don't know that it needs to be repaired.
Right.
Right. And so,
and you need to bring it to them.
Even in small moments, maybe where it's not drastic and somebody's throwing a desk at you, right? That's going to be a very obvious moment of harm where
you can apologize. I'm sorry, I threw a desk at you.
Right.
Yeah.
But even in smaller moments of where you're there's more simple verbal things maybe happening.
Yeah.
Like I tried to be very clear of that hurt me. which often that's you hurt my feelings or
Yeah.
whatever. Or you hurt my friend. I saw you hurt my friend, and that's not okay. That
Right.
I really like that one when I can call somebody out for hurting my friend.
Well, that's a very helpful
Because then it's
learning
not
thing.
about me. And instead it's just I observed you hurting somebody, and I care about that person, and they can see the care of another human being, and that they an observation. I don't know. It just pulls it out of being about me and
Yeah.
makes it about somebody else, and they can see that I care about somebody else.
Well, and it's not just children who have that happen, too. A lot of times it's adults who have that happen where you can see that your friend is getting hurt by somebody.
Yeah.
Well, and I mean, the brain injury thing is another thing where we see that happen. But recently, and this is a little bit contrary to what you were saying, we had a patient who was incredibly mean. They had a lot of underlying disorders, didn't necessarily know that they were mean, but they were obviously like trying to get people upset. And I have a nursing assistant who's been a nursing assistant for over 30 years. Like, this is a professional. I have seen this person deal with everything under the sun with incredible grace. And this nursing assistant came out of this room with tears in their eyes because the patient had been so mean to them. And as the primary caregiver of this patient, my reaction to that was first anger, of course, because you hurt my friend. You hurt my friend. How dare you hurt my friend? But you can't go into a patient room because it's an adult and say, you hurt my friend, how dare you? But what I could say was to the nursing assistant, you're not going in there again today. We are reassigning this.
Yeah.
And then what I did say to that patient was, you hurt my friend. And I've never said that to a patient before. Not once. But this was an extraordinary situation and extraordinarily hard for everyone on the floor. And I walked into the room and I said, hey, that person has been in this job for over 30 years. And you made them cry. And I need you to tone it down so we can take care of you. Just being honest as an adult with an adult. If you want to leave, you can leave. That's fine. But while you are here, I need you to be able to treat people with respect.
Yeah. I think that should be more common.
It should be a lot more
honest.
common.
I mean, based on
but
just boundaries.
What that person said, and this is where I'm being controversial with you, is that person said, send her back in, I'll apologize. And she said that to me for the next 2 days as I took care of her. Send that person back in and I will apologize. I'm not sending the person who was hurt back in because
that's boundaries.
Exactly.
No,
those are boundaries because you can't.
I totally agree with
you
that.
can't force somebody who was hurt to come and accept an apology.
Oh yeah, no.
And if you force them into the room, they have to accept the apology socially.
Same rules at my job.
You can't force that from somebody. If somebody has hurt you so badly, you don't have to be in the same room with them again.
No,
that's a socially acceptable thing to be forced to give apology, forced to receive apologies. Sorry, but that's not fair.
No, I have
people who have been legitimately hurt.
Oh yeah, well, I have a student who, on the apology topic, how do I? Because we teach kids to say sorry, and then the other kid to say, that's okay, I accept your apology. Right? That's just kind of the basic, again.
Right, but it's a social script.
It's a script. But, for starters, even at my job, there have been moments when adults have said, I'm not ready to accept your apology yet. To kids who've just done things where it really did actually hurt their feelings, right? And it was really bad.
Or hurt them physically.
Yeah, or both, or whatever. And they've said that. And that's an acceptable script on my job.
Good.
Right? Like
that's so different from most of society.
Well, it is.
For it to be an acceptable script where I'm not ready to talk to you yet.
Yeah.
Just step back.
Yeah.
Please.
Right. Sorry is not the solution at this point.
Yeah.
And that happens, right? Like, there's significant enough things where I feel like we can do better in a society of recognizing it takes a while for people to come to that point. And I have a student who gets really angry really easily, like and really struggled with the script of I accept your apology, right? Like it just wasn't hardly ever a thing the student was really willing to do, and so we had to we but what we well my school psychologist specifically very wisely um, started to use the terminology of assertive communication. Where and we started to teach a student, you don't have to say I accept your apology, but you need to be honest and kind in whatever you say. And so you can say, if somebody apologizes to you, you can say, can you please not do that again? Right? It's a positive thing. It's honest. I don't want that to happen again. It's a response instead of just not responding. And it's not a mean response.
Right.
Was the goal, right? Because the mean response is, I hate you or I can't accept your apology. That was the most common mean response is I don't accept your apology, right? Yeah. And which just made the other kid feel bad, and then you have another problem on the other side with the other kid being hurt and having to deal with that. But we're like, we need a positive, kind response. But there's we at the same time recognizing you might still need to, you might not still feel like you actually do accept that apology yet, right? That's legitimate. I don't know what's going on in your head. I don't know how you feel. I can't assume I know how you feel.
For those who are not seeing the video, I just let the dog into the room because I was willing to accept her apology.
Oh.
It takes minutes sometimes. But she is happy and looking very contrite at the moment. Yes, it looked out. Oh my god.
We have social creatures.
We do have social creatures.
To be with the family.
I like that assertive communication.
Yeah,
though, where you can still communicate and recognize each other and say, right. I need a minute.
Yeah, and I really appreciate my school psychologist because it was a brilliant thing for my student and for me trying to figure out the situation, because I agreed that you don't have to accept an apology every time you get an apology, right? And then at the same time, I agreed that the person giving the apology is being genuine and not seeking a mean response, right? And so it was a really helpful thing to just be like, oh, well, let's just shoot for communication that is honest and kind. And if you're ready to give an apology, and it's been interesting to watch as the student has used that. At first, it was mostly, he would say, would you please not do that again? Like, that was just like his base response. But as time has gone on, I've seen it seem more and more him saying, I accept your apology. Like, that's become a more common response for the student. I think just because he knows he has the power to not have to accept the apology, right? We gave him power in that situation to be like, you don't have to say this very specific thing and give just full
power to the other person.
Yeah, to the other person. Yeah. Right, yeah.
To the person who just hurt you.
Yeah. We're just saying you don't have to do that. And we gave him power by saying you can respond by maintaining power and asking the student not to do that thing that hurt you again. Right? And this was a hard thing for me, is like this idea of giving students power.
Yeah. Well, because it's against how you were raised.
It's against how I was raised, and I think in general, it's part of my values that like giving up power is better than grasping for power, right? Like
Right.
that's just generally how I think. Um, and so it feels weird to teach kids to hold
take
on to
power.
power or take power,
Yeah.
right? But that's me not understanding. I think when you consider things from a trauma-based perspective and understanding that as a human you need some power to feel human,
It's true.
right? It takes at least a little bit of power just to feel human sometimes, right? And and to and so and in this case, like just giving that kid a little bit of power to say, you know, can you not do that again? Which is like a totally acceptable thing to say, right? Like the kid said, "I'm sorry for yelling at you," just as an example, and then the kid on the other side could say, "That's okay. Can you not do that again?"
Yeah.
And it gives them just that tiny bit of power. It's just a little tiny
that's
thing,
just so different from
and it
how
resolves the
we were
situation.
raised. The
Oh,
dog
yeah.
is crying, so the cat will pay attention to her. Just
Oh,
for the record. That's different from how we were raised in the cults / religions, though, because the entire point there was that forgiveness is without conditions.
Oh yeah.
Forgiveness is entirely without conditions, and the idea behind that was like Jesus forgave you, and you were the person who killed him. And he forgives you without conditions, so you should forgive other people. But what that looked like, practically speaking, was a leader abuses you.
Right.
They say they're sorry for whatever reason.
Yep.
And then you forgive them without conditions.
Right.
They abuse you again. Same way.
Yep.
You forgive them without conditions. Because they already said they're sorry. They abuse you again. You forgive them without conditions. It was a progressive erosion of humanity, essentially. A progressive erosion of rights and a progressive erosion of humanity, because no matter what that person did, you were required to forgive them without conditions. And in the female aspect of that religion, it was a lot bigger, because like the male aspect was, you offended me, and now I'm forgiving you. There's no conditions. I forgive you. I know you're going to offend me again. On the female side of that, it was, you raped me. You sexually assaulted me. You took away every bit of power I had. Now I'm required to forgive you without conditions. And it happens again, and it happens again, and it happens again, and it happens again.
Yeah.
Just how it's so different.
Yeah. Which makes me
in the being able to put conditions to it.
Yeah.
Like, I forgive you, don't do it again.
Right.
Please.
Yeah. Well, and
which is cool.
And it makes me think like I could add to that, and maybe should in the future, just things of like, you know, like you could say, because you did that, I don't trust you as much as I did, which I've actually said to students, right? Like I'm having a hard time, especially students who tend to lie. That's been my response a lot. It's like, you lied to me, but it applies to anything.
Yeah.
It shouldn't just be lying. That's what I guess I'm saying. Like, somebody hurt you, I don't trust you as much maybe as I did previously, and you're gonna have to earn that trust back. Which again, I've said to students, and maybe, you know, I think it would be maybe a wise thing to teach students. Like, you can say that to people. Like, I've lost, you know, you hurt me. I don't trust you as much as I did, and it might take me a while, or it might take a while to earn that trust back. And that's like a totally human thing.
Yeah.
Right? Like, somebody hurt you. Yeah, it might take a while to earn that trust back of being friends. It's not going to necessarily be a snap, it's done, it's over thing. And we try, you know, at my schools to teach kids, you know, when they apologize, it's over, it's done with, right? That's like, we shoot for that, right?
Right.
Because we don't want to live in the past and in the mistakes, and so we try to move on, right? You repair the harm, we move on. And I guess that maintains, it's still the same. It's just sometimes it takes longer to repair the harm, right? Um, but you have to actually actively repair the harm. You have to earn that trust back. You have to fix the thing. You have to. It takes work. It's not just okay.
Yeah.
Right. And people don't necessarily know that without teaching them and telling them and being honest and you know, like I don't even, you know, like with the rape thing, like does that trust ever come back? Probably not. Like I don't even know what it looks like to repair that harm, you know, like
you don't repair that harm.
Yeah, that's a tough one. Like the fact that humans can hurt each other to the extent of not being able to repair the harm is, I don't know, that's a sad one for me.
It is a sad one. Well, and I feel like this does loop back to this week. I shot a woman in Minneapolis with very, very well documented video evidence that there was no reason for them to do so.
Yeah.
They had already not been able to repair any harm for a while.
Oh yeah.
Before that happened.
Yeah.
Like there is no way I can see to repair the harm that organization has done.
Yeah.
But also there's no way I can see to repair the harm between ourselves and the previous friends and family members that support those actions. It's so hard to see someone's humanity when they seem to have made themselves entirely inhuman. I don't know how to start.
I feel like the only way that that's remotely possible is for the other side to even begin to, like, it's impossible so long as the other party doesn't even recognize the harm they've done. Then it's absolutely impossible, right?
Well, because the very first step in repairing harm is recognizing harm.
Yeah, no, absolutely. You have to acknowledge what you did. You have to acknowledge the harm you've caused, and otherwise it won't ever change. That's, I mean, I tell my students it every day. You have to acknowledge your behavior to change it. And if you don't, it won't change.
Yeah.
Right? And if that step never happens, if you're the harmed party, like there's literally nothing you can do.
No, there's, because you're on the receiving end of everything.
Yeah.
At that point, you can't start to forgive somebody.
Right. Who's never acknowledged the harm they've done to you.
Yeah.
You can't. It's just the process never even starts.
Well, because there's two parties involved, and one party claims that your reality isn't reality.
I say that, and then the first thing I think of is like people who lived through Auschwitz and had to like come to a point where they could move forward.
But you can move forward without forgiveness. You don't have to forgive someone to move forward from what they did to you. And
Yeah.
Yeah.
I
Well,
mean,
because
that has to be a thing.
well, because we have to say that as
Or
people who have been harmed
yeah,
incredibly by people who will never recognize that that was harm.
Yeah.
I mean, both of us religiously, and then myself sexually, obviously. In a variety of instances, there was very physical harm done. And those people will never be called into account. Justice will never be served. Like, that will not be a thing that happens. And you still have to move forward and treat other people with compassion.
Can't, but like, I wouldn't call that forgiveness. Is there a word for that?
I don't know.
Because I don't think you can have forgiveness without apology, right? I mean, that's my takeaway from the conversation we've had now.
You know, technically, no, you can't have forgiveness without apology. I feel like in my instance, because there are a lot of people who fall into the have done horrible things to me without apology realm. And my approach usually has to be, I have bigger fish to fry. Like, I have more important things to do than wait for this person to think they still have the power over me to come and apologize. Because an apology can be an act of power. Just like in that patient who wanted me to force another staff member to come back into the room so they could apologize to them and get a performative acceptance of an apology. You don't have to wait for that person. That person does not deserve your time in waiting for them to come back to you and realize that they have committed harm.
I feel like forgiveness wouldn't be the word, but like loving yourself might be the and being willing to tell yourself it's time to move on and I am a better person than that person and I'm going to live my life.
I'm going to live despite them.
Yeah, it's interesting.
Not and to spite them in a way sometimes.
But that's that little bit of power, though.
Yeah.
Right. I feel like, and again, it's not that soft.
Yeah, it's not
hard
soft.
to fit under the loving kindness banner. Except to, I think we undervalue the loving kindness toward yourself, and that has to be there before you can love anybody else.
Yeah,
you have to love yourself. You have to have kindness toward yourself. You have to recognize that you have your own needs.
Yeah, well, in a lot of ways, you have to, because what we teach people is, how did you let this happen to yourself?
Yeah, which is so backwards.
It's so backwards.
Yeah.
What we do have to teach ourselves when we start reteaching ourselves is, this happened to me.
Yeah.
And it is an act of kindness to myself to not live there.
Yeah.
And to live somewhere else.
Yeah.
It is an act of kindness to myself to not interact with the person who caused me harm again.
Yeah.
Because there is power in forgiveness, and there have been studies that prove that the power of forgiveness for people like those who were in Auschwitz and those who forgive people who have upset them or done crimes against them, that's a real thing and is very healing, and it does cause you great mental good. But I feel like we have sidestepped the part where you can be kind to yourself and not make yourself relive that for someone else's sake, whether it be a researcher or the person who caused you harm in the first place.
Well, and forgiveness can't be for somebody else's sake.
No, it cannot.
It undermines what forgiveness is.
Right.
Right?
Right.
It has to be a mutual
healing
thing. That's what forgiveness needs to be. That's going to be a real thing. The definition of
forgiveness, though, too, is just so controversial when you really come down to it.
Oh, yeah.
Because the forgive and forget is a thing where, it's just like it never happened because you forgave them. That doesn't have to be a thing, though. As much as religious sects would cause you to second guess that, you can move on from what someone has done to you and not put yourself in a position for that to happen again.
Yeah. Which is like, I mean, again, the assertive communication thing of like, don't do that again. Right?
Or like the dog getting out today and the children crying for forgiveness because they left the gate open. And yes, you forgive them, but you can also say, don't leave the gate open.
Yeah.
And I won't have to run 3 miles in the snow to try to catch the dog.
It's a very easy solution. This problem. Yeah.
Just don't do it. Nobody will have to forgive you if you don't do it in the first place.
That's right.
You can still forgive them.
Yeah.
And not do it.
Yeah.
Have them not do it.
Yeah. At least ask for respect. And boundaries to be withheld. To be upheld. That's the word.
If you don't have boundaries for yourself, no one else can have boundaries for you.
Right. Yep. Good stuff. Creature.
Stop forgiving the dog so hard, Tess. My boundary for her is she doesn't get to run in the snow and make me chase her for 3 miles.
Oh.
I will still give her some food though.
Says dog.
Okay, I'm stopping this so I can give her food. Yes.